I am Edward K. Dunk, President of the Pan American Health and Education Foundation. Today, I have the pleasure of speaking with Dr. Marcia Paltu, who is representing the Integrated Management of Adolescent and Adult Illness, abbreviated IMAI, a program of the Guyana Ministry of Health. This program has been selected to receive the 2011 Sergio Arouca Award for Excellence in Universal Health Care, in consideration of its success at improving the access to health care in Guyana. The Sergio Arouca Award for Excellence in Universal Health Care was created in 2010 by the Ministry of Health of Brazil and the Pan American Health and Education Foundation in cooperation with the Pan American Health Organization. The award recognizes leaders who dedicated their efforts to advance, influence, and strengthen universal health care programs in the region. One such leader was Dr. Sergio Arouca, who was a physician, scholar, and tireless champion of universal health care, working at the National School of Public Health in Brazil as Secretary of Health of the State of Rio de Janeiro and Secretary of Social Participation in the Ministry of Health of Brazil. The award is one of 6 that the Pan American Health Organization and the Pan American Health and Education Foundation award for excellence in inter-American public health, which was established in 1975. What are some ways that the integrated management of adult and adolescent program has been successful in improving access to health care in Guyana, despite the limited resources available?
Right, so the IMAI program, Integrated Management of Adult and Adolescent Illnesses in Guyana, is a strategy that provided training for healthcare workers at all health facilities, starting at a primary healthcare level. And so there were over 400 healthcare workers trained, including patients themselves who became expert patient trainers. And it was an integrated approach, so not a vertical program, and it built on already existing programs or systems. For example, the patient monitoring system for HIV and the antiretroviral treatment program within the primary healthcare settings. It also, because of the way we were able to train the healthcare workers, and so many of them in all of the regions, it was able to give us access to over 90% of the population by having these healthcare workers within the region. It also decreased the cost associated with patients having to travel to seek care at other health facilities. And so it decreased the progression of chronic illnesses. So patients would seek care earlier, and they would also have the ability to manage their illnesses at their own locality or village area. It also improved the communication between facilities. So for example, primary health posts, health centers, and other facilities, and so patients could be referred back and forth easily. And it used a multidisciplinary team approach. So healthcare workers from all different countries were trained, and they were able to understand the patient from very different aspects.
What kind of diseases are we talking about in the integrated management program?
Right, so the Integrated Management of Adult and Adolescent Illness program or strategy looked primarily at dealing with HIV, but it could be applied to other chronic illnesses such as high blood pressure, diabetes, and even mental illnesses.
How have the efforts of the IMAI program improved the lives of Guyanese, especially those who are considered to be hard to reach and hardly reached?
So the IMAI program or strategy improved the lives by providing the care at their level. So they did not have to go very far to access care, and they could approach the health centers for care both acutely and for long-term management of their illness. And by training healthcare workers throughout the regions in all the facilities, we were able to cover from the health post, which is the primary or first level facility, through the health centers, district hospitals, referral hospitals. So we were able to cover the patient throughout all those regions. It also decreased the burden of illnesses, so patients would not have to travel very far, and the cost geographically in Guyana is very high when you have to travel from the hinterland regions to the coastal regions. So it decreased the burden on them from having to incur those costs. And it provided an avenue for continuous management of their illness, because they were able to seek care early for their illnesses, and they were able to continue management right there in their own village or town. It also helped them to become better managers of their own health, because it sought to educate them and empower them.
Finally, what does winning the Sergio Arouca Award for Excellence in Universal Healthcare mean to the IMAI and to the Ministry of Health of Guyana?
This award means very much to Guyana because healthcare workers have been doing programs or strategies such as IMAI for a very long time, and they continue to do so without want of recognition, and they continue to serve the people of Guyana to the best of their ability with often very limited resources. So it's a great honor and a privilege that this award has bestowed on our ministry and on Guyana as a whole. And it's a testimony that with great leadership, few resources, but selfless service, that we can achieve so much for the health and well-being of our peoples.
Thank you, Dr. Paltu, for representing the IMAI program today in recognition of the program's important contribution to the public health field. And congratulations to IMAI program of Guyana Ministry of Health for winning the Sergio Arouca Award for Excellence in Universal Healthcare.
Thank you very much.
Great.